មុខងារថ្មីអ្នកប្រើកាន់តែស្រួលនិងចំណេញពេលយើងចេញផ្សាយជិត 10000 អត្ថបទក្នុងមាតិកា29ធំសុទ្ធតែវិជ្ជបណ្ឌិតជំនាញត្រួតពិនិត្យយ៉ាងយកចិត្តទុកដាក់ឥឡូវបន្ថែមមុខងារថ្មីឲ្យអ្នកអានកាន់តែងាយស្រួលថ្មីអ្វីគឺ bookmark ឬមុខងាររក្សាអត្ថបទទុកអានពេលក្រោយចូលចិត្តកាន់តែច្រើនអាចរក្សាទុកអត្ថបទបានកាន់តែច្រើនចុះធ្វើម៉េចងាយទេចូលទៅកាន់ website Hello Groupet ហើយគ្រាន់តែចុះឈ្មោះជាមួយ email ឬកណន័យបណ្ដាញសង្គមណាមួយជាការស្រេច Hello Groupet website សុខភាពធំជាងគេនៅកម្ពុជា
Getting health information has never been this easy. With Hello Sehat, Indonesia's most trusted health information is just one click away. Leading the way since 2015 with 37 million monthly page views, 20 million monthly users, 935,000 ranking keywords, 20,000 medically reviewed articles, and 1.5 million social media followers with 90-60% of our traffic being organic and direct. Hello Sehat is committed to create a better health content that will inspire users to be healthier, from articles to videos or social media content. We do programmatic, research, online events, and even web management. Our strong research team and experts understand what is needed for people's health. Therefore, we provide an end-to-end solution from health community, live expert chat on social media, hospital booking, doctor booking, and you know what? Every communication are carefully crafted through 4 phases of our user health journey. Let's partner and make Indonesia healthier and happier.
Shift from the fear of COVID to living with it, and that the normal that we know in the past may not be there anymore.
When you take a vaccine, you're not doing it only for yourself, but for your loved ones, for the people closest to you, and for the rest of the country.
The diseases that these vaccines protect us against are more dangerous than the vaccine.
The treatment does not get rid of the virus, but it prevents the virus from weakening your immune system.
Kindness is really the currency of our time.
It's never a sign of a weakness of one's character. If we want to seek help, if we want to talk to someone.
Number 1, you can get cured. Number 2, it's not your fault that you have this disease.
And it's because they're trying to deny that they have the disease. But once you accept it, and you learn to live with it. It's really very easy to be living with diabetes.
Love your eyes and your eyes will love you back.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solution.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Kumistansya ng 1 metro.
Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
B.I.D.A. Be the solution sa COVID-19!
Sorry about that. Good evening, everyone. Welcome to the special Facebook Live of Hello Health Group in celebration of World Health Day today, April 7. My name is Kai Magsano, Country Lead of Hello Doctor Philippines. And joining me today is our Acting EIC, Bianchi Mendoza. Hi, B.
Hi, Kai. Good afternoon. I'm happy to be here celebrating World Health Day. Seems like only yesterday. Time really flies.
Yeah, so the theme of World Health Day this year is our planet, our health, B. I think, like, for me, this is very significant on a personal level. Like, for me, this is really important because today we're going to talk about the impact of COVID-19 on the environment. And I don't know with you, but when the pandemic started in 2020, right? We were using disposable face masks, disposable gloves, and anything that was being delivered by a delivery service or through a rider, everything was packed in plastic. So that's my personal observation. How about you?
Yeah. I think it's very timely to be discussing this now, especially since we're hopefully seeing the end to this pandemic, because early on in 2020 the focus was more on managing the condition, but now we can backtrack, and take stock of how it impacted the environment, the masks we used, even the face shields here in the Philippines. Everything has an impact, so it's good to take time to to see how it impacts the environment.
Yeah, all the face shields, which were then eventually phased out. So where did they all go, right? It became a big business also for a lot of suppliers. Anyway, before we proceed with introducing our guest for today, we would like to thank Healthcare Without Harm, who is our partner for this Facebook Live. Of course, we are supported by Alaga Health and Experto Play Labs, as always. And then this Facebook Live is airing not just on the Hello Doctor Facebook page, but also in Indonesia on Hello Sehat, in Thailand on Hello Kunmor, in Cambodia, Hello Krupet, and of course, Hello Doctor with a K in Malaysia. So thank you so much to our peers at Hello Health Group. Earlier today, even on the LinkedIn page of Hello Health, Graham Reed and Abhishek Rao made sure to help push this event because today is really, it's an important discussion.
Yeah, thank you very much to everyone who's tuning in now and who's sharing the video.
Yeah, I've always wondered about the impact of environmental health on human health. Like, we've always felt it, but we never really knew how to articulate it, which is why I'm excited to introduce our guest today. This is a different kind of expert. Usually we have medical experts, but the person we have today is a champion of making sure that healthcare does not impact the environment negatively. But before we introduce him, we have a video to show for Healthcare Without Harm. So go ahead, please, Doc Dex.
I used to see black spots on the lungs of mostly smokers. Over the last decade or so, I saw a series of teenagers with black spots on the lung. And I thought to myself, oh my God, what's happening?
What could be causing this epidemic of lung disease? The answer, it turned out, was in the air.
In India, the bulk of pollution comes from crop burning, garbage being burnt, vehicular pollution, and industry, which releases tons and tons of toxic smoke into the air. I have seen it with my own eyes. We need to do something about it.
Fossil fuel combustion is a main cause of air pollution in India and around the world. It's also the biggest driver of climate change.
The bushfire experience across Australia was an extraordinary experience. We had weeks and months in some places of hazardous air pollution and poor air quality. Some thousands of people were in hospital with heart disease and arrhythmias. They had heart attacks and strokes. We know that lung infections and pneumonia is made more likely by exposure to pollution of that nature.
health professionals are realizing that climate change is one of the greatest health threats of the 21st century.
Climate change is fundamentally a public health issue. We know from ample evidence that we are in a critical moment when it comes to climate action. And unfortunately, the healthcare sector, both in the US and around the world, is a huge contributor to global greenhouse gas emissions and climate change.
If healthcare was a country, it would be the 5th largest climate polluter on the planet. And if we're going to protect people's health from climate change, we need to move away from fossil fuels. The sector needs to take action to reduce its own emissions.
These are doctors from all around the world tackling climate change as a public health crisis, while also bringing sustainable practices to a major contributor to climate change: healthcare.
I do get asked sometimes, why would a pediatrician be involved in climate action? I feel that it is my duty to think about what are the factors outside of my clinic that really are contributing to my patients' well-being. If the operations of healthcare delivery are doing harm, that seems completely antithetical to the oath that I took.
What we need to do is really reinvent healthcare in the 21st century. Overall, the biggest source of healthcare's climate footprint is the sector's use of fossil fuels, whether it's burning fossil fuels on site to produce energy, whether it's buying energy produced by coal, oil, and gas, or whether it's in the supply chain, which is a huge part of healthcare's footprint.
What's shifted for me in the last year or two has been the profound recognition that climate change affects us now. If we were better at addressing disease before it gets to the point where people end up in hospital, then we can significantly decrease the carbon footprint. We need to be proactive in taking that longer term view.
When healthcare providers realize that their actions and the sector that they work for is actually contributing to the burden of disease, they're ready to take action.
The whole debate about climate change is live in our community. There has been a central commitment that the NHS will meet net zero by 2050. We employ around 1.7 million staff. I think we're the 5th biggest employer in the world. We're responsible for about 5% of the UK's carbon emissions. At Newcastle hospitals, we now recycle 43% of our non-clinical waste. 60% of our staff come into work using sustainable modes of travel, and we've banned use of diesel and petrol cars in our fleet.
Doctors, nurses, hospitals, and health systems in more than 70 countries have joined together with the international network Healthcare Without Harm to build a global movement for sustainable and equitable healthcare, for clean air, and for a healthy climate.
If we look at this health and climate change dynamic, we see hope. We see hope because individual action makes a difference to your health and well-being.
So the first step to solution is to become aware, awakened, and then only the action will come.
Health professionals today who are interested in climate action have so many opportunities to get involved that relate to energy efficiency, clean energy, sustainable purchasing, healthier foods. We're very powerful as exemplars for our patients.
Two of the greatest health threats of the 21st century are climate change and a global pandemic. And we've got one on top of the other.
I am optimistic that if we can contend with one threat at the moment, we can probably contend with a whole series of threats at the moment. It's the most extraordinary time to be imagining the human future.
If you want to have healthy people, you need to have a healthy planet.
For more on how health professionals are advocating for a healthy planet and what you can do, please visit healthforclimate.org.
Okay, that was a very
very
striking
powerful video.
Yeah, I think you know what got me. If you want to have healthy people, you have to
Yeah.
have
A healthy
planet,
planet.
right?
Yeah.
Okay. Yeah. So
We're facing two, Kai. We're facing two of the biggest threats right now: climate change and the pandemic. At the same time.
yeah, yeah. So watching that video kinda made me panic again, but it also made me feel hopeful because now we know that the healthcare healthcare professionals around the world are aware also of their impact on the environment, and they're actually doing something about it,
Yeah.
right? So, in order to tell us more about that, so we don't panic, but instead know what we can do to help the environment, we have with us today Mr. Ramon San Pascual. He is the executive director of Healthcare Without Harm Southeast Asia for 5 years now. He oversees the climate and health program of the regional office, including its projects and activities related to building climate resilient health systems, facilities, and communities. Ramon recently served as the urban climate change specialist for a project supported by ADB called Mainstreaming Resilience Principles in the Philippine Health Management System, which was meant to assist the Department of Health a resilient health facility development plan. Prior to joining HCWH in 2016, Ramon was executive director in the Asian Forum of Parliamentarians on Population and Development, based in Bangkok from 2012 to 2015, and executive director of the Philippine Legislators Committee on Population and Development. So, without further delay, let us call in our guest for today, Mr. Ramon San Pascual.
Thank you, Kai and Bianchi. Good afternoon sa ating lahat at this is a happy occasion. We are observing the day ng World Health. Ibig sabihin, pangsandaigdigang kalusugan ang ginugulitan natin ngayong araw na to. At ang tema, the theme for this for today's celebration is our planet, our health, and Healthcare Without Harm has been doing a week-long set of events, but I think particularly today we have 2 or 3 events along with other partners. And we're happy that among those 3 are one with the Alaga Health, as well as with the our group here. And hello, doctor.
Yes, sir.
This is such an encounter that we thought will serve us long way, and we're happy to kick it off with this episode on the observance of World Health Day. Good afternoon again,
Good
everyone.
afternoon, sir. Thank you for making the time today.
Yeah, we're honored, and I'm excited with the next minutes on the discussion that we are
Yes.
about to have. But seeing the video, I think it gives you the idea that when we talk about COVID-19 pandemic, we cannot avoid but also think through the crisis that is within the crisis. Meaning the climate crisis is already kicking off a severe public health crisis, and then the pandemic happens. It's not yet over.
Yes. So maybe to get the ball started, Sir Mon, for those who are watching us, not just in the Philippines, but in the other markets where Hello Health Group is, maybe you can tell us about Healthcare Without Harm. Now, let's start there. What is Healthcare Without Harm, and how does your work impact the healthcare industry?
In a lot of ways to your second question, but just to lay down the basics of what we are doing, Healthcare Without Harm, first of all, is a non-government organization, but an international one. I'm managing our Southeast Asia office from the Philippines, but we are covering the whole of the ASEAN countries as well as some East Asian countries such as Taiwan and Korea. But being a global organization, we also have our offices in Brussels for Europe, as well in Argentina for the whole of in Buenos Aires for the whole of Latin America, and then our main office is really in the U.S. and they operate not only the U.S. The entire huge country, but as well as Canada. And then we have the strategic partners in big economies such as Brazil, South Africa, India, China. So more or less that makes us truly a global network, caring for people's health, promoting public health, but merging such a mission with that of caring for our environment. So the team that we saw in the video, we cannot live in a we cannot have a healthy people unless we also have a healthy planet. Exactly, that's what we do. And how we do it, we work first and foremost with the healthcare sector, hospitals, nurses, doctors, laboratory people, engineers, other technical people within the healthcare facilities, Ministry of Health, if only to remind that producing health also means lessening the emission that we throw into our soil, into our atmosphere, into our ocean. And I think the video already mentioned that in terms of climate change contribution, the healthcare industry as one global sector, as one huge global industry, if it is a country, it is the fifth largest emitter of carbon that harm our planet and that accelerates climate change. So we are in a healing industry. Doctors and nurses are meant to heal people. But without knowing it, maybe we are not aware, we are also contributing to harming people simply because we are emitting toxic substances into our own environment. And even in the times of COVID, we are treating the millions of those who got infected with the virus. But in every patient that we treat, we're also disposing huge volume of plastics in terms of the PPE, that is both the mask, the gloves, the entire suit that is worn to protect our doctors and healthcare workers, the shield. Without us knowing, we are treating people from COVID, but we are doing a lot of harm to the oceans and then to the fish, which also gets back to us because we feed on the products of our whether it's our farm or it's our ocean. So it gets the harm that we do to our environment in many ways gets back to people through various kind of diseases. So and that's where we work, we at the intersection of environment and people's health.
Yes.
And I can show to you later how we are able to do it. But that's the whole business of healthcare without harm.
Mm. Thank you, Sir Mon. Now that we have an idea of the scope and the purpose of healthcare without harm, it's really a global initiative, and it's inspiring to see, countries coming together and taking action for a united goal. Now, we would like to ask more specifically, what are your current projects in the Philippines and Southeast Asia? Could you tell us a
And
bit more about them?
there's a lot actually. The programs that we do are divided into four key programs. One is we organize hospitals into sustainability champions, and we help them journey take care of their own environmental concerns in the hospital, and this is done through the Global Green and Healthy Hospital Network. That's the first program. Second, we are also doing sustainable procurement program. Again, the things that we purchase and we use in the hospitals add up to the emission that produces or that harm and that threatens us through climate change. 70% of the emission from hospital comes from the supply chain. So that's why we introduced this global program on sustainable procurement. The third program that we have is on climate and health. In brief, climate is a public health threat. But at the same time, as I've been saying, as shown in the video, hospitals are also responsible for emissions that worsen our climate situation. So we're doing a lot on climate and health. And the fourth is particularly on healthcare waste. As in Southeast Asia, we are one of our core programs is to take, because of one of the crises, one of the many environmental situations brought about not only by the pandemic, but even by regular operations of the hospital, there's a lot of medical waste produced. And even before the pandemic, this has been a problem. And we're doing a lot in the realm of promoting sustainable healthcare waste management, especially in the last 2.5 years because of COVID, helping our hospitals take care better, particularly of not throwing away disposables and justifying it simply because there is a virus, which is the COVID-19. So that's a lot of work on plastics, reduction of plastics waste, and reductions of single-use plastic in the hospitals. So those are the key programs. And let me try using our slides, if you don't mind. Do you think I can share my screen?
Go ahead, sir, please.
Go ahead.
Okay. Oh, okay. My own computer.
We're just halfway through and we're learning a lot, sir, from you.
Yeah, thank you.
Yeah. This undertaking is so big. And at least now, I told this to Sir Mon Bianchi the other day when we had our call, and Ms.
Yeah.
Pats Oliva, the head of communications for Healthcare Without Harm, that we want to be part of it. We want to support their projects. Yeah. So this is a start. This Facebook Live is just the start.
And what's great about this is we can all do our part, regardless of what industry you're in. You can do your part because the environment affects us all.
Yeah, maybe instead of grappling through how to project on my screen with these apps that we're using, I will just continue explaining. For example, when we talk about Global Green and Healthy Hospital Network, think of a typical hospital. We have members in Singapore, in Thailand, in Malaysia, Indonesia, Philippines, Taiwan, Korea, in Cambodia. And the basis of their membership into the GGHH network, for the information of our audience, is by enlisting themselves into at least 2 sustainability goals that they want to put forward in the years to come. And there are 10 sustainability goals within the Global Green and Healthy Hospital Network. So think of the operations of the hospitals. These include, for example, managing waste, managing energy, water, transportation, food, pharmaceuticals, ensuring that they have an efficient buildings, and then procurement, as I mentioned a while ago, chemicals, and then the most important element of those set of sustainability goals is leadership. There is no change that can happen in a hospital without an enlightened and committed leadership that embrace both health and sustainability both health and climate actions, both health and better waste management. So any hospital, for example, if I can cite, I'm from Marikina here in the Philippines. Nearby in my city is one of the hospitals under the Department of Health in the Philippines, the Amang Rodriguez Medical Center. It, it is a very strong member of GGHH, the Amang Rodriguez Medical Center. And they chose waste and then energy as the two uh, urgent concerns that they want to address. And by pledging on those goals, they become member of GGHH and we do help them. We help them, for example, among already conducted energy audit, waste audit, they begin replacing their plastics in the cafeteria with reusable, washable plates, glasses, utensils. Although the pandemic tried to reverse that, but they're getting back again. So greening their hospital would mean saving a lot of money, saving the environment because they are not putting so much waste and so much emission into our environment, as well as therefore uh, creating better health. Because again, we cannot simply attend to people's health without in balance attending to the health of our planet and our environment. So that's about the GGHH. And maybe if there are questions related to it from our audience, I'll be happy to elaborate further. But there is much more. But I turn it over to you again, Kai and Blanche.
Thank you, Sir Mon. For anyone who wants to learn more about the Global Green and Healthy Hospitals Project, the program, it's also in the Healthcare Without Harm website. And yes, if you have questions or if you are part of a network of hospitals and you want to get in touch with Sir Mon and his team so that you can work with them, you can message us, hello doctor or Alaga Health, and we'll definitely connect you with them. Sir Mon, we have to talk about the COVID 19's impact on the environment. You mentioned it earlier already, like what happened with the Amang Rodriguez Medical Center, right? During the pandemic, there was a slight setback in their program, but now they're trying to get back on track. Do we have data on the impact of COVID on the environment that you feel the public needs to know?
We do, and in fact, if we're talking, for example, the most visible impact is on healthcare waste because every patient, every treatment done in our to lessen the health threat of COVID-19 to patients, there is a corresponding about 5 to 10 kilograms of waste produced per bed. So, um, and that was the most obvious thing. But there are, and I can talk more about the waste impact. I'm really now eager to show it on the screen. So I sent an email to you, Blanche, if you're able
Okay,
to receive
sir.
it.
Yes.
Yeah. I don't know whether that can be shown. But in terms of the other impacts to our environment, for example, apart from waste itself, we must remember that the whole COVID-19, the emergence of a new virus that becomes a pandemic that emanated from Wuhan, is also driven by how much we already damage our environment. Uh, Whether it's through deforestation, meaning by cutting trees, whether for commercial purposes or for clearing the land to give way for other use of the forested land. That process of deforestation, whether logging, agriculture expansion, or mining, means you drive away uh, those who are already in that natural habitat, getting to the where people are in the city, getting those animals, those birds near where people are concentrated. And when those contacts are made, and we don't know about the virus that one animal produces that can be transferred to human, that can kick off a series of changes in the virus, such that later on we saw that from Wuhan, from China, then soon it becomes a global pandemic. So, in the first place, caring for the environment and truly preserving our forest will minimize chances of emerging viruses that can become pandemic. So, to the minds of those who are in the science of agriculture, take caring for our forest, mindless destruction and deforestation would produce more health threat into the future. And therefore, that's why they kept on saying that this pandemic may just happen again unless we really change the mode by which we care not only for ourselves, not only for our economy, but as well as for our environment. So now the other impact observed is on the uh, air pollution. Uh,
Okay.
we should be able to understand that pandemics and climate are threat multipliers in terms of inequities, illness, and injustices taking place all over the world. You may have seen reports that in certain localities, in certain parts, whether in the US, even in the Philippines, even in India, the poorer the communities are, the heavier the concentration of infection taking place in these crowded communities. Now, in many ways, this has to do with inequity in our social setting, inequity in access to health, inequity in access to good housing, inequity in terms of access to clean water, inequity in terms of uh, access to economic livelihood. So, in many ways, disruption and destruction of our environment, plus the inequity that has been around for so long, and then here comes the pandemic, all these issues will multiply over. And that is why the lack of resilience becomes a main theme as well of how much destruction COVID has caused globally. Uh, and almost there is no exemption. Uh, and then the other impact, therefore, uh, if you have already a climate crisis taking place, and then you have this threat of the migratory viruses coming up from migratory animals or birds, the severity of the climate crisis will give way to more viruses, will give way to more uh, chances of the pandemic. And therefore, if we need to also minimize chances of having the pandemic happening again in a different form in years to come, although we're not yet over with the COVID pandemic, we need to address climate change. And that's where we're saying that we can healthcare, the sector, healthcare, the industry cannot exempt itself from the whole issue of of destruction leading to climate change. We should uh, get better in terms of treating people, but we should be modest enough to admit that healthcare contributes to the destruction of our environment as well as to the destruction or worsening of our climate condition. How? Through the purchases that we use, through the wastewater that we throw to the environment, through the medical waste. Uh, would you know that, for example, even before the pandemic and much more during the pandemic, Kai and Blanchi, a doctor in a given day may change 10 pairs or may use 10 pairs of gloves in a day.
Yes. Just
And
one day sermon.
just in a day, because every time you shift into a room or you move from one patient to the other, you get another press glove, throw away the one that has been used 10 times over in a day. And yet, in several studies that have been conducted by Healthcare Without Harm, whether through the waste studies or through the utilization studies, half of those 10 pairs are unnecessary. That could have been saved in terms of the money, that could have been saved in terms of the, because these are plastic. These are non-biodegradable materials that would just float into our environment for many years to come, and therefore would continue to disrupt our environment, as well as plastic is a byproduct of the extraction uh, from uh, uh, from oil, from the fossil fuel. Again, not too many people see it that way, but plastic is part and parcel of the big petrochemical industry that relies upon extraction of the fossil fuel underneath the earth, which is a big contributor to the climate change. So you see the link of one over the other, and if healthcare sector would not be uh, humble enough and conscious enough of its contribution to environmental crisis, then we become part of the destruction of our own planet. So that's
Yeah,
where
agree.
healthcare without harm and the rest of its network do come in by making champions out of the doctors, the nurses that are becoming aware more and more of them through the various networks, taking up environmental action and climate action.
And hopefully, us members of healthcare media can also be part of that sermon.
Yeah.
I
Be
think
part of
Yeah,
the
earlier
that's
we
why
solution.
we
were.
appreciate this forum and this partnership.
Yeah.
Hello, doctor, we do see should be in the forefront as well. Because caring for our health, people's health, should truly mean caring for our environment. There's no way we can detach one from the other.
That's true.
That's true.
It's all
I was
connected.
actually, from my layman's observation, I was already thinking if we don't stop with the way we're going today, we can be sure another pandemic. We're inviting another
Exactly.
pandemic to come. Yeah, I
Within
just
the
don't know when
generation.
it's going to happen. Yes. Earlier sermon we were already projecting your slides. Would you like to go through them? We can flash them again on the screen.
Can you try it, please, from your end? Is that all right?
Yes,
So
sir,
I
of
can
course.
present it better. Yeah, please.
Yes.
Okay.
There.
Yeah,
Go ahead, Sermon.
I do see it, and uh, well, just few months before the pandemic, we released a global report on the healthcare climate footprint. And this is a global release, first that kicked off in Europe, in London, but we also have our release in Singapore for the Asian audiences, including the healthcare people themselves. And we did this in our event, Green Hospital Asia Conference, hosted by one of the greenest hospitals in Singapore, the Kotik Puat Hospital in northern part of the Singapore city. Now, just to go over to the next slide, if we can click it. Is this quote, if I may, from World Health Organization? We do know that the health sector facilities are the operational heart of service delivery, protecting health, treating patients, and saving lives. And yet, and this is from the WHO, the health sector facilities are also a source of carbon emission, contributing to climate change. Remember, this is just but few months away when the pandemic broke out. And therefore, the world's health sector facilities, meaning hospitals, churn out the carbon dioxide through the use of significant resources and energy-hungry equipment. Just imagine a facility that is lighted across the entire facility of a single hospital, 24 hours a day, 7 days a week, 365 days in a given year. How much energy do we consume? And again, if we are not conscious of it, we are providing the light into our operating rooms, but at the same time, we're contributing so much emission to the destruction of our climate and of our own planet. And therefore, if we move again to the next slide, I'll just move to the next two more, and then we can jump into the next topic. Yeah, this is what we're saying, that the healthcare as an industry, its climate footprint is equivalent to 4.4% of global net emission, which means we are equivalent to the fifth largest emitter country in the world. And the worse the climate is, the higher the chances that we are inviting another pandemic to happen. And so it did happen beginning March 2021. In the next slide, if we can, look at these countries that contributes the biggest in terms of carbon emission. These are the healthcare systems. I'm not talking country itself as United States, but rather the U.S. healthcare system contributes 7.6% of carbon emission. Japan 6.4. Then I'm citing here the rest of the largest emitters from Asia. Okay, so if we talk about Asia, the biggest healthcare emitters are those in Japan, South Korea, China, and then we can go down the line: Taiwan, India, Indonesia. So that's what I was saying a while ago, that we cannot just say that we are treating patients and we're good. Because in the course of treating patients, we are also destroying our environment and our own climate. And there's no other planet anyway. There's no plan B that we can talk about, but just the planet Earth and the climate system that runs this planet. And we are just as responsible as anybody else, whether it's agriculture sector, the infrastructure sector, those in the energy sector. Healthcare is a huge emitter in itself. Moving over, maybe the last slide, is also the other thing I was trying to explain a while ago. Our emission and this is just for the healthcare people to understand, comes from one, the energy use, and then the other is from the supply chain. Can we help it? Can we take actions to reduce it? Definitely. It is within control by managing better our hospitals and embracing sustainability in managing these healthcare facilities. And this is where partnership with hospitals, with doctors associations, with nurses groups, with the Ministry of Health, with groups like yours would be of value. We try to educate, and that education turn into action within the healthcare, and then impacting policies that hopefully the Ministry of Health will come out with. And then maybe just one more, uh, because these are really, yeah. Can we do something about the supply chain? We can. We are studying now where are the carbon hotspots inside the hospitals, meaning where are the areas where carbon emission is highest in hospitals. Remember again, climate change and pandemic are tied up. The more we destroy our planet, the better the chances that the next pandemic would come about. And therefore, decarbonizing the supply chain, for example, as I mentioned, uh, we are looking into replacement of gloves. One, to reduce the use of gloves, and then second, to find ways to have a more sustainable gloves replacement. And so as for the other PPEs, we have hospitals that we are supporting in terms of replacing the old fluorescent lamp with LED, such that again it emits less emission. At the same time, you get rid of the mercury content inside this fluorescent lamp. Remember, in the old days, in the medical field, we use devices that are laden with mercury, and yet mercury is a very toxic chemical. That's why we got rid of the old style thermometer. Remember the thermometer in the old days, where there
The
is mercury that
mercury.
is
Yes, sir.
moving for you to read the temperature. We don't use that anymore. Everything now is
Yeah.
digital. Uh,
Digital.
yeah, and even the BP apparatus. Remember in the old days, uh,
Yes.
yeah, when you read
It had
your,
mercury.
yeah, it has mercury. Those have been banned. Now, what we are trying to address are the mercury in the lead, in the fluorescent being still used in the hospital.
Okay.
So these are several or multiple health benefits. One, you get rid of the mercury that can cause cancer, that can cause other health risk. And the other is that you're able to use LED, which consumes less energy than the fluorescent lamp, and therefore that emits better light. You may have noticed this in your own homes, that LED lights are brighter and yet consumes so much less energy, and that means therefore savings both to the hospital and to the patient, because everything consumed in the hospital is ultimately charged to the patient uh, on the billing every time the patient is discharged. You don't know the diapers, the syringe, uh, all these are charged to the patients, and therefore, if you find ways to make a more sustainable product, therefore you also save money as well. So you not only save your energy and the environment by throwing away less plastics or less chemicals, but you also save a lot of money as well. So this is a kind of transformative mindset that we are bringing to the doctors, nurses, and managers in the hospitals through various networks like the Global Green and Healthy Hospital. And we also have this what we call as Leaders Net Alliance on climate action, which we call as RISE, or Southeast Asian Leaders on Climate and Health. So these are efforts that we're doing deliberately in our region across the globe, hopefully leading to a transformation that will alter the way we operate hospitals and the way we see health. Health is not just inside hospitals. Health is the very road, the street, the home, our backyard. Health is what we produce ourselves. It's not only produced in the hospital. So, and health is attached to how much health we attribute to our own environment.
Yeah. As you said, it's connected, Sermon, right?
Very much. And yet,
Everything is connected, interconnected.
the thing is, we try to operate in a silo, right? If you talk about environmental health, there are experts on that. If you talk about treating uh, COVID, for example, the doctors are the expert for that. But we should find ways to link these things better. Can you go back to that picture earlier? I saw a nice picture there, just to illustrate what I've been. Look at this. Would you believe that that this is a rooftop of a hospital?
Oh, wow. They
And
grow
would
their
you
own
believe
food.
that the vegetable and the fruits that they grow are enough for them to sell their produce every day to
It's
their
amazing.
the people that are visiting the hospitals, and as well as sufficient to feed their own patients?
Wow.
And would you know that this Kotik Wat Hospital is looked upon in their community as a park rather than a hospital, where people converge, drink their coffee, meet up, simply because it's a green hospital. It's like a park within a
Right.
hospital within a park.
Yeah,
So
this
is
should
it?
inspire.
And
Yeah,
this
and
is
I'm
where we
sure.
did our conference in 2019. And this is the kind of a model where we think, uh, because think about lighting. We see hospitals that are just four walls of bricks and cement, and then air cons all in every room, right? But this hospital, they have large windows, and they studied how the wind blows, the direction, so that it is captured and it flows into the rooms, facilitating healing. Same for the sunlight. Rather than block it off, you study where the direction of the sunlight and then the soft light in the afternoon. And this again contributes to the healing. This is where the whole hospital becomes really green, and and effectively, justifiably, you'd call it a healing place, because healing comes as well from enhancing what the nature gives us.
Environment. That's amazing because it achieves two things, no? It hastens healing, but also it helps you save on electricity. It provides
Exactly.
ample lighting that you don't have
Exactly.
to use, and it's well
Exactly.
ventilated. You don't have to use air conditioning as much. So it achieves, not just healing, but caring for the environment. So that's a
And
great
I think,
example, sir.
yeah, I think the biggest common lesson of the COVID pandemic is the significant role in health of ventilation. This is the past 2 years we got rid of our fully aircon rooms, right? But rather we create ways to welcome the wind going through the building, going through the room, replacing the small window with the bigger ones. Because exactly, rather than shutting down what the nature provides you to facilitate health, we should welcome proper ventilation, proper lighting, and even the sounds of the birds. This is where most patients would testify in this hospital that the mere chirping of the birds make them feel well right away, and they hear it every morning because the trees are all over. So and and that's where what we are trying to point out what a green hospital is about. Of course, it's different layers. No, I cannot compare Amang Rodriguez near right where I am with this beautiful hospital in Kotik Puat in Singapore. But if the leadership and I see how the leadership of because the medical director of Amang attended the conference in 2019 and brought their the management, three or six of them. So when they came back with the learnings that they saw, not only what they heard and the exchanges done in the conference room, but what they saw as an illustration of the hospital itself, and we all eat a no meat food for the entire 3 days of the conference, and it's wonderful, healthy, and even very appetizing. So then the belief, therefore, that we can transform our healthcare into something that is greener and sustainable is strengthened, and now they're trying to adopt those lessons in Amang Rodriguez. That what is that is the whole purpose of Network Global Green and Healthy Hospital, to teach, learn, expose, investigate, and encourage one another. The next
Okay.
conference is in India in 2023.
Okay, hopefully
Around
we can be there.
February, and we will welcome you. We will send you our invitation, and you may want to present yourselves in certain sub conferences or small group meetings. But definitely, we will inform you about it. I think Hello Doctor should be in that conference.
Thank you so much, Sir Mon. Before Bianchi asks the final question to close today's special episode, I think because of everything you have been sharing for the past hour, people are listening and they're getting inspired. We have one question from Facebook from audience Princess Esguera. Her question, good evening po. As normal citizens, what are the simplest ways that we can do to help mitigate the effects of COVID on our environment?
As normal ordinary citizen, keep yourselves healthy, please. Take care of yourselves and keep yourselves healthy in a in a profound and yet simple way. When whichever that you know that will harm your health, keep away from it. Whether it's the cigarette, it's too much alcohol, 3 hours of sleep every night, and then you keep yourself active, because keeping yourself healthy will keep you away from COVID. And people do not exactly appreciate what some of the doctors have been telling. If you keep yourself healthy apart from the social distancing, wearing of mask, then most likely you wouldn't catch the virus. It is first and foremost what you are inside of you that protect you from COVID. And if you keep yourself healthy, this is the whole point that I'm trying to make. Then you don't contribute to the plastic waste produced during the entire pandemic. You remember the medical waste, the plastic medical waste from the PPE is produced out of every patient that is brought to the hospital. So proper COVID waste management, as well proper COVID management, and how our different governments have attended to COVID would care for the environment as well. So if you think that caring for your individual health and your family, because health is a habit, okay? Let me talk about this. I'm a public health advocate. Health is who you are. You don't point out health to people or to the medicine that you take, but it's really who you are, the kind of mindset you have, the kind of behavior you have, the the the, the thoughts and the language that comes from you, it's healthy or not healthy. So choose health. And by doing so, you keep our planet healthy as well. Again, your healthy behavior catches on with your environment. You become responsible. If you want to be healthy, therefore it's easy for you not to drink water from pet bottle, because you know the moment you do that, you throw it away, then you feed it to the fish, and the fish would not eat it. It will just they will take the microplastic, and we catch that microplastic whenever we consume fish. So you see where health is. So the simple way of saving our planet and minimizing the impact of environment is keep yourself healthy in a lot of ways.
That's
Okay,
what we
thank you,
can all
sir.
do.
Yeah. Okay. Bianchi, you have a final
Thank you.
question for Sir
Yeah,
Juan.
before I ask the final question, Sermon, I wanted to thank you because we really understood and felt the urgency of your mission and how important it is. We'll come away from this FB Live with a new perspective on health and the
Yeah.
environment. So, for our final question, what is your message now that you've shared your message to regular citizens like us for healthcare institutions and HCPs this World Health Day? What would you like to tell them po?
That we are co-responsible in caring for our people, in pursuing the healing mission, the do no harm oath. If you notice, we keep it even into our name. We are the healthcare without harm. But that do no harm extends not only to your patient, but take planet as well as your own patient. And therefore, in every step that we do, whether the kind of gloves that we wear, the mask, that how we educate our patient, do matter to our planet. And therefore, it's not only by the behavior that responsible behavior that every doctor will take to care for the patient and to care for the planet, but as well as translating this into advocacy and what we call as climate actions. Be part of organizations. Speak up. Talk with your people in the Ministry of Health. Address your associations. Talk about plastics in healthcare. Talk about the everyday mask that you wear and how we can further reduce plastic consumption in healthcare setting, and talk about health in a profound way, that health belonging to us but also shared to the planet.
Okay. Thank you so much, Mr. Ramon San Pascual of Healthcare Without Harm, Southeast Asia. Thank you, Bianchi. Like
Thank you.
what Bianchi said, this has been a cathartic episode. I think everyone who tuned in and who will be watching this episode will be a changed person after watching it. Um, we are all connected, and how we take care of ourselves reflects how we take care of the environment. So, Sermon's
Exactly.
message: take care of your health. And just today we published a story on microplastics having found their way into the human body. And then we read a lot of stories on what we call apocalypse fatigue. Like younger people now are choosing not to have kids because they are seeing what is happening in the
Yeah,
environment.
true.
So the choices we make today, whether we are parents or there are younger people looking up to us, that will really influence the future of mankind and this planet. So again, this Facebook Live on World Health Day is just the start of. I can see that it's going to be a wonderful partnership between Healthcare Without Harm Southeast Asia and the Hello Health Group. So again, Sir Mon, thank you. Bianchi, thank you. Dr. Dex Galban, who
you.
provided technical support today, Alaga Health, Experto Play Labs, and all the markets of Hello Health who gave their support to bring Sir Mon's message out to audiences across Southeast Asia. Thank you. Until our next Facebook Live, this has been Kai Magsanok of Hello Doctor Philippines. Thank you and please stay well. Goodbye.
Thank you so much.
Take care. Stay healthy.
Bye-bye.